This conference will now be recorded.
Carol? Oh, there she is.
I'm here. Can you hear me?
Yes. Can you go ahead and introduce yourself, please?
I didn't understand that. What?
Could you introduce yourself, please?
Oh, I'm Carol Gray, LMT board member, Portland.
Thank you. Okay, and members of the public.
Hi, I'm Sergeant Ronnie Klug. I am an LMT 25770 out of Portland.
Welcome.
Thank you.
And can I say, do we have any public members joining virtually?
Yes, we have Lisa and Krista Rodriguez.
Krista.
And Laura.
Hi, folks, could we get you to introduce yourselves?
Hi there, can you hear me?
Yes.
Hi everyone, it's Krista Rodriguez, LMT 13287.
Welcome, Krista.
Hi, this is Lisa Hamilton, Portland, Oregon, LMT, license number 3527.
Welcome, thank you.
Laura Pereira, I'm the Director of Government Relations for ABMP.
Welcome.
Okay, if that's everyone present, we're gonna go ahead and approve today's agenda. Is there any discussion? Okay, then can I get a motion to approve the agenda?
I motion to approve the agenda.
Second that.
Thank you, all in favor?
Aye.
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 Opposed? The agenda is approved. Okay, is there any discussion regarding the minutes from our May 13th meeting? Hearing none, can I get a motion to approve the minutes?
I'll move to approve the minutes from May 13th, 2024.
I second that.
All in favor?
Aye.
Aye.
Opposed? Okay, the minutes are approved. Okay, moving into board business, I will go ahead and turn this over to Director Ruark.
Thank you. Good morning, board members, members of the public. I'm going to do my director's report here. I'm going to read some of it, and then some I'm just going to kind of go over a little bit. You guys have the director's report in your packet. It's a little extensive. Talk a lot about the budget. So at the end of the first fiscal year of the 23-25 biennium, the board maintains a bank balance of about $208,000, which represents slightly over 2 months of working capital. 2 months of working capital is what we strive to maintain in our reserves. We've been able to meet that goal for the past several years. We've been above that goal, but the pandemic took quite a bit of our capital. But we've been able to maintain the 2 months, which is what our goal is. Our current income as of July 1, 2024 is $1,127,000. And our total expenditures to date are $1,202,000. A difference of approximately negative $74,724. So I'm not too worried about our over expenditures right now. Basically, during the biennium, we get billed for things for the entire biennium, and it happens at the beginning of the biennium. So at times we'll have over expenditures the first year, and then we'll have under expenditures the second year. And I'd like to be able to figure out a way to make that all balance and look pretty. But the problem is I don't get a list of what they're going to bill me, how much they're going to bill me, especially the state assessments, until after I build the budget, because I got to build the budget before the biennium. So what I do is, what I'm going to do, I'm rebalancing the budget. So this biennium, or this first year of our biennium's over, and what I'm going to do is do what they call a budget rebalance. I'm going to look at it line item, and I'll go over that a little bit later. I'm going to have that available, the rebalanced budget available for the board at the business meeting, which is the next board meeting, for the board to approve and review. So our post-pandemic recovery is a little slow. There's many reasons, and I'll try to go over some of those for you. Our income is very easy to figure out, right? Our income is based on our renewals. You know, we run off of what we make. We don't get anything from the general fund. So I can figure out how many renewals we have, how many different line items we have for income pretty easily. My problem is trying to figure out, especially during the pandemic and even post-pandemic, what our expenses are going to be. We had when I created this budget, the labor unions were still in contract negotiations. And so what I do is I look at the CPI, you know, cost of living increases, and I go, okay, this is what I figure it's going to be historically based on what the numbers are. And it's usually pretty close to what it is. Unfortunately, this time, the comparables they had, inflation went to the roof in 2022. It's since sort of come back down, but during that 2022 time, inflation reached a high, big high, like 13-14%, which normally runs 3 to 5 or even lower than that. So when they did the comparables, they said, okay, to fight the inflation or the cost of the high cost of living, the labor unions wanted more money, basically. And the state agreed and gave them a 13.05% salary increase over that 23-25 biennium. I figured about as high as 3.5 per year, so a 7%. So what we got was a 13.05% salary increase over the biennium, along with a $1,500 per person bonus that the labor unions in the state agreed to offset the cost of living, basically. It's the first time that anybody can remember that a bonus was ever given to state employees. And it was really good for our employees. It helped out quite a bit. Unfortunately for us, that's nothing that I build into the budget, right? It's never happened before, so I couldn't build in a $1,500 per employee bump. I also couldn't have anticipated a salary increase, the amount that was approved. So the second part of and so it caused us to spend more money. The second part of our slower recovery is basically the increase of cost of goods and services. When inflation goes up, you may look at the bottom line of inflation and go, okay, inflation is only 4% right now. But when they build those numbers, they look at several different categories. So housing and different categories. For us, when we pay the state, when they're building their budgets, they look at those numbers too, and they go, okay, this is going to be your share of what you're going to pay for these state assessments. You know, state assessments are things like fees paid to other state agencies for work completed on our behalf, like computer expenses, archive expenses, insurance costs, payroll processing, all those things to run a business, right? Which is what we are, kind of. We're a semi-independent board, so we run off the revenue that we make. So when I built the budget, I didn't anticipate that some of those things were going to be through the roof. Like our share of Microsoft 365 that we were required to go to because of security reasons. We were quoted, it would be about $1,500 per person. Ended up being about $3,000 per person. So when you're building a budget and the budget is kind of as tight as we are, you don't have that double the amount of money to kind of just spread around, right? And I can't go to the legislators and ask for more. We don't have that ability to do that. We also had a hearing over this last biennium that was pretty high profile. We had over $50,000 just in legal and hearing fees on that one particular hearing. I think it was closer to 75,000. It might even exceeded that. Now, we don't often have those. So when we do have those, we can usually weather those pretty good when it's not COVID. You know, we can say, okay, that costs us a lot of money. We can move some money here, move it there. But when we add COVID and the lower amount of revenue that we've had, it's kind of hard to recover from that. So I'm just kind of giving you a snapshot of where our budget's at. We also had a slower than projected rebound or growth in our new applicants and our initial licenses. So I'll give you kind of a rundown of that. We had this spike pre-COVID. Our growth rate was phenomenal. I can't remember, I think it was like 15%. I mean, we were getting lots of applicants every year. It was just a huge growth. When COVID hit, it flattened, and then we had people leave. They left the state, right? We had people not renewing their licenses. They went inactive because they figured if they couldn't practice or for health reasons, they were going to go inactive and keep their license, which, you know, inactive license is half the fee of an active license. So it kind of went like this, and then it dropped. We had a drop of about 500 licensed massage therapists at the outset of COVID. We lost about 500 massage therapists. We do have growth right now. That growth is about 1%, okay? So we're basically level and we got a 1% growth. That's good to hear, right? Because it's going up, but it's not like it was before. It went from 15% to 1%. So when I'm trying to figure the budget and I'm adding the numbers in and I go, okay, we had a 15% growth. We had no growth here. Where is it going to be post-pandemic? You know, I sort of picked a number. I had to pick a number. I picked 2 or 3 or 5% or whatever I picked of growth. Well, we haven't reached that yet. So that's another reason that our budget is not where I would like it to be. So I gave you a little bit of historical perspective about what's going on with our budget. You know, I intend to rebalance our budget for the second half of the biennium. And what that means is I'm going to go line item by line item, and I'm going to take a line item of the budget that has an excess of money, and I'm going to move that money to a line item that we overspent in. So at the end of everything, I want it to balance, okay? And I think we're going to be able to do that. I'm not necessarily concerned about being 75,000 over for this first half of the biennium, because like I said, most of our fees that we pay for state assessments happen at the beginning of the biennium. So I think we'll make that money up. That's my hope. Either way, I think we're going to be able to, even if we lose a little bit of money, I think we're still going to be able to maintain that 2 months of working capital, that reserves that we need to maintain. Having said all of that, I'm going to start doing a little bit of research into the feasibility of doing a fee increase. Now, I want to be clear, I'm not currently asking for a fee increase, I'm not advocating for a fee increase. I'm just in the interest of transparency, I'm simply going to study it, okay? Our last fee increase was over 5.5 years ago. The one before that was about 7 years previous to that. Again, I'm not suggesting a fee increase. I'm simply letting the board know I'm going to review our current fees. I'm going to put the budget all together and see where we're at money-wise. I'm going to look at all the other states where they're at with fees. I'm going to look at, we're going to have to look at cost of living and all of those things and the price of doing business and determine whether me suggesting a fee increase to the board is something that we need to do. And that'll, if either way, if I suggest a fee increase or don't, it's going to be at the next board meeting, the business meeting. All that documentation will be provided to the board. Any questions about anything regarding the budget?
I actually have a couple.
Yeah.
The first thought I was having with that 1% growth that we're having, I'm guessing that that's probably more in line with where we might be for the next several years because it looks like school capacity is reduced. Is
Yes.
that going to be what you're thinking?
I agree. I think schools have really had a difficult time recovering from the pandemic. And basically, they do have students that want, not as many students, but they do have students that want to attend school. The problem is the schools have reduced their class sizes. And some schools have reduced, like some schools will put 3 or 4 classes a year through. Some schools have reduced that down to 1 class a year, 2 classes a year. So yeah, I anticipate that growth is going to be, if it recovers, it's going to kind of stay at that 1%, maybe a percentage a year, or maybe staying at that. I don't anticipate a lot of growth.
I wonder if we had contact with the school administrators, what their max graduation rate for the year would be. I wonder if they could give us numbers.
Absolutely. Yeah, we have the next schools meeting that we have, all schools meeting, we can talk to them about that. I know the last one we did, they gave us a lot of information that was very helpful about what they're struggling with, trying to keep their classes full, and instructors are a big thing too. They're having a hard time finding the instructors to be able to run more than 1 class.
Okay.
We don't know how that federal financial aid
Yeah,
thing is going to affect it.
absolutely.
And the other question I had was, you said the last price increase was 5 years and then 7 before that. Do you know what the jump was in each of those increases?
It was $50. Was it $50? It went from $150 to $200 for the renewal fee. So it was
155.
Yeah, that's right.
155 to $200.
$45.
It was what?
$45.
Yeah, it was a $45 increase for renewals, which is the majority of our income are from renewals. So it was a $45 increase for 2 years. So you divide that by 2, and so that much a year, $22.50. Yeah, $22.50 a year basically was the increase.
Any idea what it was at that 7 year before that? It's okay if you don't.
I don't have that historical. I can certainly get that information, but it's about the same. If we ever do fee increases, we don't do a fee increase to say we want to build the coffers. We do a fee increase to pay the bills, basically. So if I study a fee increase and let's say we're $150,000, $110,000 in the red this year, any fee increase that I would suggest is to cover that $110,000, which, let's say it's $110,000, that would be a $25 fee increase for 2 years. So $1,250 per year fee increase. That's just a number. I'm not saying that's what it is, but so we don't do fee increases to try to fill the coffers. We do a fee increase to pay the bills.
Thank you.
I have a question. What are our opportunities for cutting costs?
Absolutely. Not Not a lot. Our budget is pretty tight right now. Our biggest expenditure is payroll. So the only way really to cut an amount of costs, a substantial amount of cost, would be to lay employees off. And that would really be the only way to do it. And that would be pretty catastrophic for this office because we're kind of running on, everybody has multiple jobs that they're doing right now. So to lose an employee would be very difficult. Of course, if that's the way it goes further down the road, if we just can't get any money, then we have to do what we have to do. But the rest of the budget, I'll present it line item by line item at this next meeting, so you'll get a better picture of exactly where, we have excess and we don't have excess. But we're pretty tight with it, with the budget.
Director Brewer?
Yes.
What a lot of people don't know is if you lay off an employee, okay, that may save money right now, but then everything else goes up. The time to get your license extends.
Absolutely.
The time to get all of the licensing thing, day spas, everything like that, that increases. Then that increases the complaints. And then when you have more phone calls, then you have phone calls that can't be taken for people who want to actually renew their license.
Yep.
So you're chasing your tail continually. And I think the direction that you're on is probably the best right now.
And keep in mind that we actually have a vacancy right now that we're not filling.
Yeah, we do. That's correct.
And during COVID and post-COVID, we took some cost savings adjustments, like our digital program where we're not using postal services and the printing and stuff that went with that. And that saved us, I can't remember, about $30,000 a year or something like that. So, I mean, I don't know what else we can cut.
Yeah, we cut.
Unless we're gonna turn the
During
lights on.
COVID, during COVID, we cut a lot of things out. We started emailing the licenses instead of printing them, so we didn't have to buy all the paper and all that stuff to print it. We started digitally sending off the reminders, which we used to mail those. We also just switched just recently to the state is offering a bulk mailing program for the things that we do have to mail. And I just switched to that, which saves us, I haven't looked about how much it's going to save us, but we went from paying like 68 cents per envelope that we mail out to 26 cents. We do a lot of mailings. So anytime that I can save a little bit of money, we're jumping on it. We had, during COVID, we also stopped out-of-state travel and in-state travel. Everybody was working from home, so we had less energy cost, less cost at the office. Although that increased our computer cost, right? Because I have to have our computer guy make sure and repair everybody's computer around the house and those things like that. So there's a trade-off there, but I'm always trying to find a way to cut. Absolutely, Carol. Thank you.
I also have just an observation, and this is maybe more casual than something I can back up with numbers, but my sense is, from what I hear out there in the world among licensees that I communicate with, is that they're all pretty busy. I think it's interesting that schools, for a variety of reasons, are not seeing sufficient students to enlarge their programs to create some new licensees or in sufficient numbers. Yet it seems like the demand for services provided by licensed massage therapists, that demand is really high right now. People are busy. There are lots of employment opportunities for people that maybe would like to be employed as massage therapists as opposed to starting and running their own businesses. So I think it's really interesting. And I wonder if there's some promotion thing that could be done to get people excited about choosing this career. Anyway, that's just a
Yeah, if you don't mind. So, go ahead, Mark.
I attend a lot of national massage meetings with different boards, and it's kind of a national issue, and I don't know why that is, and I don't think anybody can kind of figure out why. I know there's a little bit of slow rebound with COVID. I think the schools are being cautious about building their programs up as big as they were before because a lot of them took a big hit. So I think they're being a little bit cautious about bringing that staffing level up to where it used to be. I also think a lot of them lost a lot of money. So they're, to build their school back up to as big as it needs to be, they're having a difficult time. Well, they're being cautious about it.
Well, a few of them closed and then they reopened.
Yeah, exactly. A few of them closed, never reopened. They opened up and at halftime. So I'm not sure it's necessarily the amount of students. I think it's sort of the schools being cautious about it. We are getting a little bit of an influx from out of state, but not a lot, not as much as we used to. We had a lot of people moving here and pre-COVID. And I think that's what was boosting our numbers up a little bit. The schools were bringing people out and we were getting people moving here. But I think everybody's just kind of staying put. I'm not seeing a lot of people moving to Oregon like they used to back in those days. And the governor's office reached out to me about that topic. They had a concern with every one of the boards. Are people leaving Oregon and are people coming to Oregon? Because people were coming to Oregon and everybody was staying here pre-COVID. After that, it kind of went haywire.
Riots.
Nobody was coming and everybody left. So they were concerned about it. Yeah, they were concerned about that. And so the governor's office is tracking that statistic with all the boards and commissions. And our next meeting that we're going to have, they're going to give us those numbers. So I think we're going to find that everybody's having that problem, not just massage. So.
Thank you. Any other questions regarding that? Okay.
All right, I'll move on to the next one here. So we had a little bit of an issue with our office. So as the weather heated up, we found that our office that we're currently leasing had a major air conditioning malfunction. The owners and managers have been very accommodating. They've been working diligently to repair our AC unit. It's a big building. It houses multiple businesses in there. So they have a couple of very large AC units in the business, and one of them went out. I understand it's a gigantic unit. I don't know if it's gonna have to tear the roof open to get it out of there and have a crane drop it in, but the entire building is being heated by one AC unit. I mention this because at times our offices were in the 80s and 90s. Our staff was having a really rough time there, so we tried to make some accommodations. We purchased individual fans for office staff. We allowed them to dress down. Sometimes they're wearing shorts, nice shirts, just because I wanted them to be able to work. We also let them work from home if they need to, if it simply got too hot. So our problem is that there were a few days there during this really extreme heat that we had to close our office and work from home. When we work from home, we answer our calls that come into our office via cell phone. And so sometimes our stuff goes to messages. And I want to apologize to everybody during this heat wave that there might have been times you weren't able to get a hold of us, but we put it on our website that we tried to make sure we called everybody back that left a message. We're one of the very few state agencies that I'm aware of that we answer every phone call. We have a messaging system, but it's the only time it happens is if we get 5 or 6 calls at a time when there's only 5 staff that are working and we have not enough people to answer phones. It'll go to our voicemail and we call them back. We like that personal service. The board is happy with that, and that's what we want to give our customers. But I apologize to our customers that during that time, there might have been some times that we couldn't get our phone. Also, there was a resignation on the FSMTV Board of Directors. Basically a state deregulated massage. And so that particular director was a executive director from that state, and he resigned as a board of director member. There's an upcoming meeting in Washington, D.C. There's also an upcoming meeting in Fort Lauderdale, Florida. And the FSMTB needed to fill that position, so they reached out to me and they asked me if I would be interested in filling their vacant board member position until that person's term ends, which will be in Washington, D.C. in October. I agreed to do that. The FSMTB board is staffed almost exclusively by member board executive directors and administrators. It's a volunteer position. It'll have no effect on my current duties as the executive director for this board. It was quite an honor for Oregon to be chosen by FSMTV, as they represent all 50 states, and they have 46 member states, along with Puerto Rico and the Virgin Islands. So they had a big pool of people to pick to fill that position, and they called Oregon to have us fill that position. So I think it's an honor, and so I'll be doing that until that board member position is filled. Any questions about that?
Congrats.
No, congratulations.
Congrats.
That's huge.
Yeah,
Are you happy?
congratulations.
Thank you.
I'm proud to be a board member for a board that continues to be a national leader in this industry. So yeah, congratulations, Bob.
Thank you, Drew.
You're absolutely right too, Carol. It's going to these meetings, Oregon is very well respected at a national level, and for as small as we are and stuff, it kind of feels strange, like, wow, just a little old Oregon, but we are doing a lot of things right, and they do use us as a positive example.
Any other questions? Okay, I'll talk a little bit about board member recruitment. So I'm still working, we have one position open. It's our public health member position. So basically, it's a public position, but statutorily it's required to be a public health member position. So what that means is a nurse, a chiropractor, a doctor, somebody that has a public health license. It's a hard, yeah, except an LMT, it can't be an LMT. It's a hard position to fill because all of those professions are working pretty hard in their lives, right? Doctors, nurses, they all have businesses, they're all working. I know everybody does, but it's just kind of a hard position to fill. We've done a lot of recruiting. We've reached out to schools. We've reached out to, I've done so much recruiting. In fact, all of us SEBA boards, semi-independent boards, got together and we did basically a press release that we sent out to multiple different places because we're all hurting for board members, and we didn't get anybody apply. So I'm still working on it. If anybody knows anybody that's interested, please let me know. I'm happy to help them apply for that position and walk them through the process.
What about PTAs or CNAs?
Yeah, I think so. Absolutely. Yeah, that would be awesome. Yeah, just to have them reach out to me and I'll send them a link to it and then actually walk them through it if they need it, whatever they need. I'd be happy to have that position filled and help whoever.
Bob, I have a question about,
Yes.
administratively, considering everyone's struggling with this. And we have areas in the state already that are healthcare pharmacy deserts. We're very under where we need to be as medical professionals. Is there any talk about maybe approaching the governor's office or doing something to change the requirement for this position? Because it seems like no one can fill it. And we haven't been able to fill it since the pandemic.
Yeah.
I'm not sure this is gonna.
Yeah, it's a statutory requirement, because I looked that up. Because I was thinking, well, if this is just in our rules, we can do some changes. It's a statutory requirement. I have talked to the governor's office about that. They're not excited about that. The idea behind it, I think, was to have someone with some public health background knowledge in there that can kind of understand the MT side of it, and still be a public member. And those of you who might not know, this board cannot do any disciplinary action unless a public member is part of the process. So that's why public members are real important. If we had an entire board of LMTs and no public members, we could not do disciplinary action because it's what's written into the statute. So that's why our public members are important. That's why if any of them can't attend a meeting, I always make sure we have another public member there. So having 3 of them is pretty important for this board. To answer your question, they're not excited about it, but I think they're helping us out by doing a lot of recruiting for us. They're changing their governor appointments processes and their recruiting. They're hiring people. They're placing people in different positions to kind of help us recruit. They're doing job fairs and things like that, things that they've never done before. So I think, hopefully it works. It takes a while for those things to get a foothold, but hopefully it works.
Thank you.
Yeah. Any other questions? Oh, I got one more thing here. So board member Carol Gray has agreed to accept an appointment for a second term on the board. Yay. Yep, her first term is set to expire on September 30th, 2024. I moved her application over to executive appointments, and the next confirmation hearings will be during legislative days, September 23rd to 25th. What's nice about a reappointment is, Carol, you don't have to go there. You don't have to attend a reappointment like you did when you initially got appointed. And thank you very much for agreeing to continue to serve on the board. We appreciate it very much. I appreciate it very much. Thank you.
Well, you're welcome. So far, it's my pleasure.
Thank you, Carol.
Any questions about board member recruitment?
I do have a question about the public health position. So what if they do have a public health degree, like a bachelor's degree in health education and public health, but they're also an LMT? You can't.
No, they can't be. In fact, when I looked it up, because I did some historical research, it's been that way for a very long time, so I did some historical research. And it actually says in the documents that they can have no connection. They can't even have a spouse or a significant other that is an LMT.
Okay.
Yeah, no connection at all with licensed massage therapy. Any other questions? I'm going to talk a little bit about our COOP plan. So Governor Kotek, back in January 11th, 2023, issued a directive requiring state agency boards and commissions to have in place an updated annual continuity of operations plan. So basically, this is an emergency operations plan. And the COOP plan is something that it's kind of an emergency contact list. So if something were to happen to a board member or a staff member, we know next of kin, all that kind of stuff, or emergency contact information. But it also talks about in the event of a power failure or our system going down or ice storms or COVID, it's kind of an emergency operations plan to put into place if something were to happen that was beyond our control. The board approved that plan at the July of 2023 business meeting in Hood River. The plan is required to be updated annually and submitted to the Office of Emergency Management by September 30th of every year. So most of that information is taken from Workday. So, things like your address, emergency contact, phone numbers, things like that. I'm updating that plan right now. So what I would ask is all board members and staff, I'll be directing the staff, prior to the September board meeting, if you could make sure your information in Workday is updated. What you want in that emergency operations plan. So your phone number, your address, your emergency contact, if you have one, not required to have one, and all the information in Workday updated. So when I move it to the COOP plan, there's no questions about, no problems with that. So that COOP plan will be coming to you at the next board meeting, the business meeting, for review and approval. Any questions at all? And then finally, my last topic here, I know it's a lengthy director's report, Matilda. So FSMTV has a program called Matilda, it's MTLD, and it's a licensing database. I can't remember the acronym. It's a comprehensive national database of licensed massage therapists that facilitates information sharing between state massage regulatory boards and agencies. Better information improves efficiency and effectiveness in licensure. So when Matilda first came into being, Oregon was the first board to sign up for Matilda out of all the boards in the nation here. We have since not participated in Matilda because the program changed from what it was initially to what it is now. And what it is now, it's a tool to facilitate mobility and license portability, to combat massage education fraud, and to mitigate human trafficking. We signed an agreement. I brought it to the board here a couple of meetings ago. We signed an agreement to participate in Matilda, and we were we're waiting to switch our IT providers. We had a independent company do our IT work for us. That independent company, first of all, our infrastructure was old and outdated. And it was a one-man show that we hired, so it was kind of, we were having a difficult time keeping our infrastructure going. We've since switched to the state of Oregon, IT, DAS IT. I think we have all the bugs out, except we had a little bug this morning, but I think we have all the bugs worked out. So we signed the agreement to participate in Matilda. What makes Matilda important also is that if the state of Oregon ever agrees to participate in the interstate compact, Matilda is a required element of that. So if Oregon, if the legislators decide to vote in participating in the interstate compact, if Matilda is already established, it'll be an easy transition instead of us trying to get that built and get all the bugs worked out before or after we sign the compact. If the state of Oregon ever does that. So I think it's a step in the right direction. You know, like I said, we're always moving forward, right? We're always trying to be on the cutting edge. So that's going to be coming up. After we get our IT on board and we get that program working, then I'm going to give the board a demonstration, show you how it works and what it provides for us and for you.
Do you think that'll be at the business meeting?
I hope.
Okay.
I hope. So there's a lot of schedules that we try to get all together, you know, to get it working. If I can get everybody on the same page, then we can get that program up and running pretty quick.
Fantastic. Any questions about Matilda? Great, thank you very much, Bob. Let's go ahead and turn this over to Jeff for compliance.
Thank you very much. So the compliance and licensure report is pretty simple this meeting. Licensure still remains steady, both initial applications and renewals. As the director pointed out, growth is slow, but we are busy. I mentioned the air conditioning system. Bob already covered that. We haven't actually, I don't think we're actually out of the office more than a couple hours the entire time. But we could stay until about 3, and then it was like, what was it when you had the thermometer thing up?
91 in my office.
Yeah, it was 91.
Yeah, it's pumping out heat instead of cold.
But compliance has been really busy. It's steady as far as caseload, but it's the time of the year that we renew our contracted investigators, and I believe everybody is coming back on board that we want to keep. There's a new anti-trafficking alliance that formed in Central Oregon that involves 4 counties over there. They reached out to the board with interest that we participate with them regarding human trafficking in the massage industry. And then as we got to working together and networking and sharing information, they actually have invited us to join their labor trafficking task force subcommittee, which is something that it doesn't involve a lot of time, but they wanted some industry people on there that actually experience what's going on so that we could help them design some of their interventions and programs and services for their agency. And so I talked to Director Ruark, and we will be participating on that in a limited capacity to help them design and establish their policies and procedures for how they're going to handle those things over there. The FSMTB Establishment Task Force, as you may recall, Oregon was selected to participate in that program, in part because we're Oregon and we're awesome, and also in part because we're one of the few states that currently licenses facilities. So I participated over the last year in that. I believe we've finally completed our model policy rules and laws, which will include a big toolbox and models for all other states who wish to adopt and initiate a procedure for licensing facilities and having jurisdiction over them, like we do. Many of the Oregon rules and laws and forms that we have for that were actually used as models, and We tweaked them a little bit to make them a little more generic. And so that'll be presented at FSMTV's October annual meeting. And they've invited me to be part of the presentation panel, which means I may be going to the October meeting with FSMTV paying for me to go instead of the board. So I was kind of hoping I got out of that one, but it looks like I might be going. I haven't signed up yet, but it looks like I'm going. And to top it off, some of you may have seen in the news lately that there was a big to-do over in Newburgh regarding some illicit massage facilities. They just did a press release on that, what was it, late last week? Board staff, including the director, all worked together with local law enforcement there to combine our efforts to basically dismantle two illicit massage facilities over there, including follow-up with, they went in with search warrants, and it's really nice to have law enforcement actually follow through with the part that they're supposed to do. And Newburgh did a great job. I monitored some of their Facebook postings for their agency, very positive feedback, both for the law enforcement and for us. I thought that they handled it very well. They had victims assistance there for the women that were being trafficked, as well as they're taking kind of a hard look at the other players as to who might have been in charge and should be criminally charged. So they're still sorting that out. And as an added bonus, this gave us an opportunity to present to the city there, if you had this model ordinance, we could prevent these from ever opening in the future. And so they have a copy of our model ordinance, and they are very enthusiastic about getting that passed in the future. And this is a great kind of platform after taking this action on these two illicit facilities to then follow up with the ordinance. They have a lot of positive momentum going forward. City administrator's very strong on it. Chief of police is very strong on it. So that may be one of our very first, besides Caboose, to have that ordinance in place. I think it's very strategic to be in Newburgh, because you got McMinnville, and then you start getting into Portland Metro. You're not that far from Salem. It's a great place to have this kind of take off, I hope, and go to other cities successful.
Jeff?
Yeah.
Two things. Great job. And can you forward the link of that interview to the rest of the board members? I thought that was really good.
Oh, the Channel 12 one or something?
Yeah.
Yeah.
That was really good. You can tell that they were really putting their foot down.
Yes.
So that was really good to see.
Very happy to also see, not only did they follow through as they promised, and not all of them have in the past, but they actually recognized that we really helped them out, which was kind of cool. And especially when you're doing press releases and then the press gets a hold of it, usually the story that comes out in there is not at all like the one that was in the press release or what actually happened, but this is actually pretty accurate. Other than I think they referred to us as a special investigation unit or something, made it sound.
Yeah.
Made it sound a whole lot cooler than we actually are. But all in all, it was super positive. So, and we actually got approached, so they did an interagency task force to help serve the search warrants, because they're a small agency, and so they brought in a detective from McMinnville who pulled myself and Director Ruark aside and said, we need help in McMinnville, and we want to do the same thing. So we're already starting to get a daisy chain kind of response to this. So we're going to try to keep that ball in the air.
We also had another agency in the state, Portland metro area, that might be adopting the model ordinance, and has reached out to us for a resource. So, Portland is our biggest, the Portland metro area is our biggest amount of illicit massage facilities besides Southern Oregon. And to get law enforcement on board is paramount. We've been working on that for years, maybe even a couple decades.
Mm-hmm.
And it's nice to see that kind of finally coming through. A lot of hard work on Jeff's part.
We're going to take a small town approach and just, and I think that's going to work. Anyway, it's nice to have years and years of building these relationships and our reputation, and occasionally getting shut out, even though we went with good faith, and then have them have their prosecutors say we're not going to do anything. This was very successful, and I think it's going to be a great platform for us to just continue to build.
Well, I think that's a huge applause based on management and staff because of background and your willingness to do all this. And it's a huge deal, I think, since I've been here, that Portland's stepping up and that they're gonna do something.
We'll see. I mean, what we're doing is we're
slowly
getting
working.
closer and closer to the Portland metro area where they're going to be forced to make a decision of either this is going to be the place where these businesses exist and thrive, or we're gonna work on shutting it down. And
You guys deserve a lot of kudos. This has been a long, hard, I mean, with all of the cases that we have seen, this is.
we
I'd rather
put
not
a lot
see
of time in that, and we did it on the cheap. Instead of using our contracted investigators, who I have to pay considerable amounts of money, and they're worth every penny, I tapped Director Ruark and said, how do you feel about getting out of the office and going do some field work today?
Since the office is 100 degrees.
Yeah, it says, might as well be outside enjoying. So I tapped both Mitch and who's, has always been a goal to, as Mitch took over in his current role, to start to get him some field experience so we'd have another investigator in the house. And so he's pretty much there now. He's done enough of these. So myself and Mitch and Bob did the entire investigation for these cases.
Wow, thank you.
Bravo.
Congratulations.
Bravo.
One more way we can save budget money, but at the same time, when we're out of the office, it means you gotta come back and you got 50 emails because you've been gone. So I mean, like you were saying, you start chasing your tail a little bit, so you gotta be careful about it. But it was a good model. I think it worked out very slick, and it's something we hope to continue and repeat.
Police were really appreciative.
It also keeps you on the ground too.
It does keep you on.
And refreshed as to what you're doing, so that's fantastic. Bravo, guys.
Thank you very much. Are there any questions regarding compliance or licensure?
I'm just also want to weigh in that I'm really impressed at the level of coordination with this, and I know that you guys have been working so hard for so many years to get some buy-in from other agencies, and this one went so well. And I've got well, I have one question, and I'm super excited that you had victim assistance people right there. And I'm curious about how many takers they get, and maybe that's unknown to people in this meeting. I'm just wondering that when we provide those kinds of people right there on site in one of these big busts, like who actually says, yeah, I need some help, or like not who, but how many. And then the other thing too is that I believe I read that one of the workers was taken to the hospital, and so good that happened too. So anyway, I'll turn off my mic now.
Those are great points,
Yeah.
Carol. And the law enforcement side of this, we don't act as their agent or vice versa. So these were parallel investigations, and we didn't have we have professional input, suggestions, giving them our expertise, et cetera, but they set up what resources they brought to the table, and they brought the advocates, and they brought the medical staff and stuff to make sure everybody was attended to. That said, I don't believe they're going to know until much later. Perhaps they know now. After they process the evidence, like the cell phones and the bank records and the other things that they seized, to determine who's a victim and who is actually a ringleader. And so while we treated everybody there as potential victims, I have no idea how many of them actually were and if any of them actually took them up on some of the, I don't want to call them benefits, but the services and resources that were available to them. Historically, I think in part due to the cultural differences and the way that this trafficking system is run differently than some of the more traditional labor trafficking and stuff, that oftentimes they don't consider themselves victims, which is unfortunate and something I think everybody's working on changing. But I have very rarely seen anybody take advantage of those resources. In fact, the only ones I know in person are the ones that I've been to these trainings and seminars on trafficking, and they bring one in that was saved to speak to us. It was in the massage industry. I've seen other saves in other industries, but they're few and far between in this industry. But everybody's trying to change that culture. It's just going to take some time. And yet, you just don't know the pressures on these poor women about what might happen to their families in China and stuff. And it's not being a speaker of their language. And they did bring in very talented linguists to do these interviews and stuff through the FBI and everything. So I know that the communication was as best that we could do. But being on the outside, I can't pick up on and listen to the interviews and understand what the conversations are and get any kind of sort of idea as to whether or not they're victims or bad guys. So if I learn anything different, because we do have great communications with this law enforcement agency, if I do learn anything like that, I'll be certain to bring it to the next meeting and let everybody know if there was any successes on that front.
Thank you very much.
Thank you.
Thank you.
Can I get a motion for a 15-minute break?
Motion for 15-minute break?
I'll second that.
Okay, everybody, let's take 15. Be back at 10:13.
This conference will now be recorded.
And we're going to go ahead and continue on. We are at our 2025 board meeting dates.
Yes.
Tyson?
I'll take this one.
Thank you, Bob.
All right, everybody, they got your calendars, so we're gonna build the board meeting dates for the 2025, year 2025. We have 6 meetings, right? January, March, May, July, September, and November. So we'll go month by month, and then I guess it's gonna be one of those consensus kind of things. So, Kaite, could you tell us what day we had the meeting in January?
Oh, yes, I can.
Because what we like to do is, one thing we have to be cognizant of when we build these is, of course, other events, right, like, that are going on.
January 22nd?
Holidays and things like that, but we also want to make sure that there's plenty of time in between, board meetings. We try to have about 2 months in between board meetings. So if you do like a late January, you should do a late March, because if you don't do a late March, you give us only a month and a week to get a board meeting together, so.
I think we have November 4th, that's the meeting before that.
November 4th.
Okay, gotcha,
Yep. There's January's up there, circled orange and green.
Gotcha. So we did the 22nd last year, Jim. November 4th is the meeting previous to that, so do we have any suggestions?
Are we already have our things? It's already squared on the 20th.
No, if you look at the key on the bottom, one of those is a state holiday.
That's when state employees have the day off, state holiday. So all of those gray boxes, no one gets.
So that means they can't come to a meeting.
Yes.
Correct.
You have to pay us a
You
lot.
have to pay us a lot.
Yeah.
Yeah, a lot.
Union stuff.
I'm gonna suggest the 13th.
The 6th or the 13th work fine for me.
Not the 6th.
13th sounds,
I'm gone the 6th, and I may be gone the 13th. Be a game time decision.
is it gone, like not be able to remote, gone?
NFL games. I'll be flying on that day.
The 20th, I'm free all of the Mondays in January, you know, but for the national holiday on the 20th, so.
I know I'll be flying on the 6th. On the 13th, I have my airline ticket, but I'm not exactly sure if I'm actually going to go, so I'm fine if it's scheduled on the 13th. What about the 27th? That would be fine.
I'm good with any of them.
That puts us out quite a ways from the previous meeting, so just is that okay?
Yeah, it is okay.
Holidays in between.
Yeah. The problem is that, you know, it'll build no, there's December, yeah, there's a bunch of holidays, so that's probably a good idea.
Okay.
It'll just be maybe a little bigger caseload for compliance. But those holidays are gonna affect that.
Yeah,
So
exactly.
the 27th would work.
I think so too.
Well, does that work for
I
everybody?
propose the 27th.
Second.
Wait,
We're,
Yeah.
We'll vote at the end.
yeah, we're not.
well, you actually have to.
Yeah, it's okay.
That way we all know we're on the same,
Vote.
that way we know we're all on the same, the 27th.
Perfect.
Kathy, you good with that, 27th? Okay.
Perfect.
So we're going to March then, because it's kind of a later one, maybe toward the end of the month, maybe that 17th.
That's St. Patrick's Day.
Okay.
I mean, we can, it's just March 17th. That's important.
Well,
To a kid named
it is
Green
for
and
those of us
Riley?
driving on the
Oh,
highway.
Okay, good point.
The 10th or the 24th?
I'm just gonna take that spring break.
Yes, please. That's right, spring break.
I'm looking through the 9th through the 16th, I've not booked my flights yet.
I'm looking, yeah, because I was like, I'll be down for spring break, so.
The
24th?
24th?
Guys.
Hold on, let me
Hold on,
just.
she's looking.
Not the 10th for me, but the other Mondays work.
Okay.
Where's the calendar?
What school district?
I'm any school, they're all the same in Oregon. Spring
No.
break is the same for the whole state.
They're not.
For the,
Greater Portland area, maybe.
But for up and down the I-5, yes.
Yeah.
When you get into Central Oregon and Eastern Oregon, they do.
Up and down I-5?
Yes.
I think we might be on the same.
yeah, we are always
I
the
said
same,
the
sailing,
only-
everything. I've never seen anybody do nothing, anything. So it's the week of the 24th. It looks.
It's like Pendleton School District starts.
I mean, we could do the 31st.
Yeah, that works.
She's looking.
Yeah, I think that's right. That would make sense. So yeah, the 24th, we're the 24th is spring break.
24th. So which one do you want to do?
17th?
The 24th?
Either the 17th or after.
Not the 17th. He
That
has
was the
a.
same.
Okay.
I mean,
No.
it doesn't matter.
Yeah, you brought it up, Ray.
It does. The director's Irish.
Okay.
I know you have to have alcohol?
No.
Oh,
Yeah.
Hanging out
Okay,
like
can we,
Okay, so
can we do the 31st?
31st.
Okay.
31st.
that would work well because it's almost exactly 2 months.
Yeah.
yes, let's do that.
Is it May?
Let's look at May here.
Oops. Okay.
It's like the first 3 weeks, or 3 Mondays, or. Let me ask something before we go any further. Are we looking at keeping September for the business meeting? Like I know we hashed this out at one of the last meetings. July was always tricky because of all the track and field and school and vacations and things like that. So I think you guys moved it to that following one, which is September, just because it's better it seems for everybody. If we want to keep it there, then we can decide that now, or
I'm even cool the last part of September, 1st October. The weather's still good no matter where we go. And my work has kind of calmed down a bit, but my work continues.
so September still works for the business meeting for everybody,
Yeah.
the 2 days?
Did we choose a day?
No, we're just making sure we
Okay.
didn't need to have a 2-day block in either May or July, so.
Yeah.
Okay.
And we've done it, so we go to what, like May 19th or 26th?
26th is Memorial Day.
Memorial Day, and everyone's gonna be gone.
Is May 19th available for everyone?
No,
Wow. So they will.
No?
no, not for me. For me in May, just a second here, the 5th works and the 12th work, but not the 19th and the 26th is a holiday.
April 5th is barely 6 weeks.
Yeah.
Yeah, that's not the 12th or the 19th.
I understand.
She said no on the 19th.
The
12th is good for you.
12?
The 12th or the 2nd?
The 12th works.
12.
A short turnaround is also, it'll be pretty good, I think, because we've gone 2 full months in those other ones. A short meeting is not.
We do it all the time.
Yeah.
Okay, July. Any hard no's to any dates?
I'll have some. I'm just looking them up here.
The 7th is out.
I can do the 7th. 14th is okay for me. And let me forgive me here. I got to look at a different calendar here.
Does anybody else have any rule outs in July?
I don't.
Okay,
No.
14th is okay, 21st is okay, and the 28th is okay. So yeah, I'm good there.
you want to do the 14th since it's 2 months?
Yes.
Okay.
That'd be perfect.
14.
Is that good for you?
Okay, September, so our meeting in September is gonna be a Friday, Saturday.
Yep. Doesn't look like there's any holidays.
What? The first? is-
Well, no,
Okay.
on the Friday, Saturday.
Chipping, yeah. I'm gonna suggest like 18, 19, or 25, 26.
That's.
Or 19 to 20 or.
Yeah,
26,
19, 20.
You guys know where I should.
Whatever you want.
Yeah, I'm good, wherever.
Anybody have any no's on that?
20, 26.
I like the 18th and 19th rather than the. I'm sorry. Is it 19th and 20 rather than the 26,
It'll
27?
start after June.
After Labor Day, okay.
Actually, I would say the meeting might be a week before, but
Okay.
it might be in August.
Everybody sounds good with the 19th and 20th of September for the business meeting?
Sure.
Yes.
Okay,
Sounds good.
then we're looking at November.
That's always a tricky one.
Yeah.
It is.
17. James. Yeah, 17th is because of the holidays.
Yeah.
The 17th is what?
17th is
Monday.
like a
Before the
week and a half
holidays.
before
Yeah.
Thanksgiving.
Yeah, but probably work. Good.
17th is good for me.
Yay.
Okay, sweet.
Okay, 17th.
Way too easy.
That didn't hurt.
Okay, do we need to read those into the record, or are we good to just?
Yeah, let's read them into the record, just so we'll make sure we're all on the same page.
So at this point, we have put forward to have our board meetings on January 27th, March 31st, May 12th, July 14th, September 19th and 20th for our business meeting, and November 17th of 2025. Can I get a motion to accept the?
Motion to accept the calendar dates for 2025?
I'll second that.
All in favor?
Aye.
Opposed? Motion carries. Thank you, everyone. That was pretty painless.
Yeah.
Okay.
Let me get strategic plan pulled up here.
All right, board business, right?
Strategic plan, right?
No,
The action plan update, or is that,
no, I go first.
what do you do?
I do.
Oh, the business meeting.
Good, I can't
Boy,
believe
I'm
it.
excited. I already checked it out. Why did I do that?
This is the thing, we did it. So the board, business meeting will be in Bend, Oregon at Central Oregon Community College on September
7 and 28?
Thank you. We will be staying at, what is it going?
Peppermill.
Thank you, Pepper Tree in Bend, Oregon. And everything else will be taken care of for the board members before them, but information will come to you in the email, so please check your email regularly as we get closer, because you'll get all the details then. Thank you.
Thank you.
And the purpose of having these traveling board meetings, the board decided a long time ago that they wanted to be able to provide an opportunity for LMTs in different geographical locations to be able to attend a board meeting. And because if you had them in Salem all the time, people might have to travel to Central Oregon or Southern Oregon, or even the greater metro area might be difficult. So we've had meetings all over the state. And it's something, I think it's great outreach. And having it at Central Oregon Community College especially, we've had it at a couple of colleges down south. We end up getting the LMTs coming, the students coming in and attending board meetings and seeing what's going on. We get LMTs sometimes from Eastern Oregon that come over for the Central Oregon meeting. So I think it's a great it's built into our budget, and it's a great opportunity for other weeks.
Last meeting in River, we had an LMT show up.
Yep.
Hey.
That's great.
Okay, anything else on that? Kathy?
No, that's all
Okay.
for now, thank you.
Bob, back to you.
Yeah, so the strategic plan, the last board meeting in July, the one in Hood River, the board built this strategic plan. It's a 5-year strategic plan, and you've seen the workbook. It's attached to the packet here. It's broken down into depth, several different areas that the board wanted the staff and the board itself to focus on. We, as board staff and myself, have tried to work on the things that were assigned to us, specifically the full board process review. This board process review is basically a top-down, reviewing everything that the board does, the board staff does. I'm talking about the board policies and the procedures that we do and everything. And we've had a couple of meetings. Then we had a whole bunch of issues that came up where staff was gone for emergencies and things like that. But we have assignments to different staff regarding things that we want to accomplish. I think we're on track. At the September meeting, board meeting, business meeting, I'm going to give a presentation on this. That's going to be a little more in-depth than this, but I wanted to bring it to your attention that we are working on our strategic plan. Right now, between the last board meeting and this board meeting, I printed off every single board policy that the board has ever written. And I looked through all the minutes to see the ones that were rescinded. And there's a bunch of board policies that have been written out there that need to be rescinded or updated. I'm going to bring those to the business meeting and have the board decide what the language they want, or, we just reinstituted our committees. So the board may send those to committee to be rewritten with some direction. There is a lot of things in our strategic plan. Like I said, I'm going to give you a more in-depth update. But there are things in here that deal with our rules, that deal with leadership development, the growth of staff, and basically regarding our rules. Myself and Akaite have, I know, been working on the rules. I went through the entire rule book from beginning to end and found some errors and some language that need to be corrected. My thought process is if the board is going to the whole rule review, and if some of that stuff needs to go to committee, then it'll go to committee. I found something in our rules that's kind of funny to mention. The board, when it was first implemented, was called the Board of Massage Technicians. And there is a reference in our rule to the Board of Massage Technicians. It's still in there, and it's been missed since like the 1980s. Nobody's caught on to it. So this is the kind of review from 1 all the way down to 100, right? And you read everything. And that's what I hope to accomplish. And it's a process. It's going to take maybe a year or two to get all of that worked out and fixed. But this is what the board wanted to focus on. I think it's going to make us more professional, and it'll make it for the LMTs, it'll make it clear what the direction is. So is there any questions about the strategic plan right? I said I'm going to be doing a presentation that we're going to go kind of line item by line item, probably take me an hour at the business meeting, since we don't have to spend an entire day building a strategic plan like we did at the last one. We can do a little more in-depth dive into it. So any questions?
We're not going to have the same presenter there, are we?
No, she just helps us build. It's my responsibility to maintain it from that point on, to make sure that some progress gets done on it.
Okay, thank you.
So it'll just be me doing a PowerPoint and hopefully we'll get somewhere with where we want to go with it. So, any other questions? I want to bring it to your attention so if you have it. So if you decide you want to look at it before the next, we'll put it in that packet too. If you have a little bit deeper, I just want to kind of put it in the back.
Perfect. Thank you, Bob.
Yes.
Okay, next thing we have to take care of is the FSMTV annual meeting delegate election. We had about that last time because I have a minute to speak about this.
So the last delegate meeting, the board had elected me to be the delegate, and just simply because it was COVID and nobody else really wanted to travel at that point. That's since changed, and it sounds like some people want to travel. I did some research. What I did, well, first of all, myself, now that I'm on the board of directors for SFMTV, represent the board as a delegate. So we're gonna have to pick a delegate. That's the first part. The nice thing is that I'm paid for by FSMTV, so it's gonna cost our board nothing for me to attend that meeting, which will be nice. Jeff has been asked to attend as part of that presentation for the committee that he's on. So Jeff will be going paid for by representatives from Oregon at that particular meeting, which is nice. We'll be well represented there. The thing we need to talk about is the board is going to need to elect a delegate. Now, the reason I was kind of recommending that I did that this year, because I recommend that has been to that board meeting as a delegate before, and it can be a little bit sort of like the United Nations, right? Room, and you have all these flags of your state voting, and you vote on these different things. Everything will be voted on at the direction of the boards. So we're going to get, the delegate will get all of the packet of everything that's going to be voted on. That packet will be brought by the delegate to the board. And decide how you want that delegate.
Question?
And yeah.
Does Oregon have a flag?
Yeah.
Yes.
We actually have the only two-sided state flag.
We do.
Okay, thank you. I
One
was.
side got like.
I learned that from Sheldon.
1852
October.
Thank you.
It's yes, in October at Washington DC. So it's the annual meeting of the delegates basically. And at
It's the
FSMTV.
3rd through the 5th.
Now, let me go a little further on that. I did some historical research. Kind of messed up. We've sent kind of people willy-nilly about it because of COVID. I looked in our rules, our bylaws. I looked in our historical information. There's a historical document that we have that says who is assigned to what, okay? That document and every other document that I looked at, traditionally it's the board chair that is the delegate for that particular meeting. That doesn't mean we don't send other people, but the delegate is traditionally the board chair. In the absence of the board chair, it's the vice chair. That's written into our sort of, during COVID, it got moved around a little bit, where kind of anybody went. In the past, we've sent 3 or 4 people to kind of prep them to be a delegate, or the vice chair was unable to attend the meeting. I'm a little bit concerned about sending, a bunch of people. I would like to, since we're represented, send a delegate. We can afford to send an additional individual. We can't afford it. It's written into the budget to send an additional person. So I defer to the board about what exactly you want to do with regards to a delegate. And if you want to send a person, just so you know, or you want to hold off at this particular year and maybe look at next year, sending an additional person to kind of train them up. And who do you want as your goes. So that's my, there we go.
I can, don't want to go.
This year?
I want to say two things. First of all, there's some latency, I think, on your end, and you're
I
cutting out,
would love to attend, but if it's not,
and maybe people can't hear me either. Uh, I had expressed an interest in attending, and it turns out I'm
Yeah.
going to be traveling elsewhere then, and I can't go, so that's out of the question. But again, there's latency, and I'm
Okay.
having a really hard time seeing and hearing all of you. I'm going to restart my computer. I don't think it's on my end. I got 285 down here, so but nonetheless, I'm going to restart. So I'm going to leave the meeting briefly and come right back. And again, I'm not
Okay.
interested attending this meeting, and but the FSMTB meeting, that is. I'll be right back.
Thank you.
Thank you.
I would be interested in one as well.
You would be interested in this year? So, that's, at this point, yeah, we have to decide if we want to spend the money to have more than one person go. And do we have an idea of what that costs?
Roughly, it's not hugely expensive. Let's see, what did you see? I went last year, it's probably about 2,500.
Because they pay for,
They pay for nothing. If we send, they will pay for a delegate.
okay, they pay for Beckett, and then we pay for the
And
additional.
we pay for the additional. It's always a good idea to send an additional. I mean, I'm kind of torn because I'm cheap right now because of my budget, but it's always good to send an additional person because the experience of being able to do that we have a backup, and eventually I'd like to send everybody, one person at a time, but two people at a time if we can afford it, to see the meeting, to see how it goes. So if Beckett or whoever's in the chair position cannot go and the vice chair can't go, then we end up having to send somebody else. We'll have somebody with us some experience. So yes, we can afford it. It's roughly about 2,500, I would say, to send somebody. That's with airfare, food, lodging, and it could be a little bit more, but that's roughly what it has been traditionally. So yes, we can afford to send somebody. It's up to you whether you'd like to do it or not. And I think what you should do first is vote your delegate in, who you want to be your delegate. And then once your delegate is all set up, then you can have some discussion regarding whether you want to send an additional person and make that determination. So that would be my recommendation.
I move to send Beckett as delegate for
I'll second
2024.
I'm a strong believer in seniority, so to speak, so yes.
Okay, so can we go ahead and take the vote? We have quorums. So
Do we want to wait?
That's what I'm asking. Do we need to want to wait?
We don't need to.
she said she wasn't interested in going.
And she's got other plans.
Well, right, but just.
She's on?
Let's wait for her to go.
Okay, let's wait for her.
Yeah, she's not back.
Perfect.
Well, I guess we can just talk about the other part then, right? So.
Well, we've got a motion on the.
That's right, there's a motion, yeah. Okay.
Try a moment of silence.
Yeah.
Who second? Oh, there's a motion, no second yet.
Yeah, Raymond got the second first.
I like that we're competitive for promotions now.
That's weird. Ashley Hernandez from FSMTV just sent me an email saying, FSMTV annual meeting estimated costs.
Okay.
Literally, right now.
Oh, she's in the meeting.
Yeah.
Beckett, we do have a few more people if you wish to give them an opportunity to, public member.
Okay, while we're waiting for Carol to return, if you came into the meeting after
There she is.
Okay, we are going to put a pin in that. Carol, there is a motion on the floor to send me as the delegate. So we are going to vote on that at this point. All in favor of sending me as the delegate to FSMTB 2024?
Aye.
Aye.
Opposed? Okay, motion carries. And then the next order of business is deciding if we would like to send another person as the backup. Jeff, what did it come in as?
Oh, it's broken down. Airfare 600 round trip to Ronald Reagan, it might be a little more from this far away, don't know. Ground transportation 150, parking 100, travel and meals about $50 a day. Planned meals, so those are the ones that they've already catered, are $645 per person. That includes the Thursday, Friday, and Saturday meals. Hotel is $319 a night plus taxes for 3 nights. And the meeting registration is this one here, $350 for non-executive member, board, or agency staff.
Right around 2,025.
Yeah.
I feel pretty
It's
good.
like you've done this before. Considering inflation, okay.
Yeah.
So I'd like to put forward that this is kind of a tight year, and while I love you three, I don't think you're gonna have any competition with me in the next 3 years.
Mm-hmm.
Don't think you're gonna have any competition for me in the next 3 years, unless it's in Texas. So
It is
I,
in Texas.
I was gonna say,
Next one is in
it
Texas.
in Texas.
no, it's not. It's in Kansas, Missouri. It's
Okay.
Oh,
Kansas
that's
City,
their-
Missouri.
That's right, that's their
Highway.
home base.
Okay.
So, and I'll be done. So I'd like to say maybe just tighten our belt for this year. That's just a suggestion.
No, I mean, I respect it, and again,
Because think about the longevity. 8 years? Are you guys planning?
I try not to plan that far ahead.
I wasn't planning on 8 years. I'm sure Carol wasn't either, but it creeps up on you and it's like, this is really cool. This is so, I think the opportunities are probably there, but like Bob said, he's tightening his belt, and I think we need to just tighten it for 1 more year.
I will say something I did ask in our prep conversation is, if we choose not to send someone, I wanted to make sure, if I were to go next year, that we have some institutional memory of how this works, and Bob has assured me he is not retiring next year, so if we have somebody who knows what's going on, who will be going to that, so if that helps you make your decision. Any other thoughts?
Yeah,
You might
I'm in-
want somebody.
I'm in favor of
How do you feel about it, Becca?
I think Carol was saying something.
Carol, please.
I was, I'm in favor of belt tightening.
I'm kind of in the same boat as Bob. I see a benefit to both. so-
Yeah, I think the experience is really kind of invaluable.
Yeah.
And I would absolutely jump at the opportunity, but I understand if that's not the way it works out. Scott also said that he would jump at the opportunity, and you've got seniority, so that would make sense. If we were to send somebody, it should probably be Scott, but, yeah.
Scott or Melissa, do you have an opinion on austerity versus?
I don't care. I would go at some point. Yes. Whatever you guys want to do.
Well, that puts opinions in
At a split.
split.
And my vote is
Do we vote?
a cast of my desire to go, so I don't want to cast a vote beyond that.
You're such a nice guy.
Okay,
That's good.
I'm gonna go, I think I could throw my hat in the ring. My gut would be to have you go if you want to and are willing, and it will not do us in, so.
It won't, no, it's a negligible amount of money really regarding, and it's a one-time thing, and it's, so, it's not huge.
Thank you.
It's just anytime I can cut a little bit here and there too, but I think, like I talked about in the budget presentation, I think we're gonna do okay at the end. So, I was just hoping that we wouldn't send 5 or 6 people. So one person, I'm okay with.
Oh, yeah, now you put that out there.
Well, no,
Thanks, Bob.
Start with the bad news and, you know.
Yeah,
no, I appreciate.
it's okay, I don't like being the bad guy.
Well,
I move
I think, thank you.
that we should send Scott to the FSMTV.
Second.
Okay, Ray and Maria on a second. All in favor of sending Scott to the FSMTV 2024 conference?
Aye.
I,
Opposed?
No,
Okay, motion carries, thank you. Scott will be attending.
Yeah.
Yes.
and if he doesn't attend the backup, great.
Yeah, if anything falls through, anything comes up, I'm happy to step in and also go.
And if he doesn't
Thank you,
attend
this is,
the backup,
people wanting to participate is a wonderful problem to have. So
Yeah.
Thank you, it's
okay.
actually wonderful.
Traditionally, we've always sent a new board member to this FSMTV meeting. So this is exactly what we've been doing for many, many years. We got off the rails with COVID. We weren't sending anybody, we were, and so everybody that have been attending meetings, these that have attended them in the past, are gone now. Because they all transitioned off during the beginning of COVID, the end of COVID, right? So
Maria
this is.
decided she didn't want to go.
Yeah, this is something that needs to happen. Eventually, everybody will attend one of these meetings, because I think having everybody understand what happens nationally is really important, and you'll learn a lot, and you'll be able to glean a lot of information. So, and hopefully next year we can send 2. We might both be able to go next year.
Can we see them on
Kansas City.
Zoom or whatever?
Yeah, I think so.
Yeah,
No,
yeah.
I don't think so.
I don't think so.
I don't think so. No.
But the meeting notes and everything are on there.
I'll look into that for you.
I think we did look into it, I'm pretty sure it's not virtually available in real time.
Yeah.
Okay, thank you everyone for that conversation. We're gonna move on to board member new business proposals. Would anyone like to introduce any new business today?
I would like to speak for a second. Could I get a definition of 687.057?
ORS or OER?
ORS.
657, you said?
687.057.
Oh, what specifically are you looking for?
Do we have any systems in place to abide by this ORS?
Yeah.
We do? Okay.
Can you define what it is?
When I first applied for licensure from Nevada, I called the board and asked about this and was told that it's not a thing. So that was actually part of the reason why I stepped up and volunteered to serve on this board, is because I was confused about this specific law and how it's supposed to work. And my point being is, would enacting the Interstate Massage Compact bring us more into compliance with this law?
Yes.
So there's a couple of different things that we're talking about here. License by endorsement, which is spelled wrong, by the way, that's one of the things that I changed. That's not endorsing a check, you're endorsing, So, and that's written into our statute, as you can tell. We have this one, and we have one about license by endorsement if you're a medical professional. Okay, that's the 2 sort of statutes that we have. This was built, I believe, with an idea leaning toward the eventuality of an interstate compact. Okay? This basically says that you can be licensed by, it gives the authority to the board to license people by endorsement by rule. Okay? We have no rule we do have a rule. There's one rule about licensing them by endorsement as a medical professional. Okay? So if you're a chiropractor or you're a doctor, for that matter, in a different state or in this state, and you want to use your education and training, this statute allows us to write rules to allow that to happen, okay? What we haven't done in the past is allowed, because every state has a different qualification for licensure. So this allows the board to write rules to do license by endorsement. It doesn't say you shall.
Okay.
It says you can write a rule to endorse them. It was written for the medical endorsement side of it and for the eventuality of an interstate compact.
There was one state we had it set up like when I first started here, it was actually New Hampshire.
Yeah.
Because they had a practical exam at the time as well. And because of that, we accepted their practical exam and you didn't have to take that practical exam. You could apply by endorsement. But no one has that practical exam.
Yeah. And it's so
that was the only time that I'd seen it.
It's so difficult to change statutes, right?
Yeah.
It takes literally an act of Congress, right? It takes you got to get the legislators to sign off on it and approve it and get a bill passed and all that stuff. So when they built our laws back in the day, they tried to look at every eventuality, right? Do you want to have a law that allows you the authority by rule to endorse people if they move from state to state? And the question back then was posed, and they said, absolutely, we'd love to have that. Well, we're gonna write this statute that says you can make it happen. You gotta have a rule, you can write a rule to make it happen. And the board said, we'll write a rule for licensed healthcare professionals, and in that case, New Hampshire back in the day. But they never wrote one across the board, just simply because at that time they wrote this, it was 30 hours to 100 hours to 500 hours to 600 hours to 90 hours to no hours to be a licensed massage therapist in different states. So historically, this statute allows.
Yeah, I was licensed
really
in
helps
Oregon.
us if the board.
I was
the state.
Sorry. I was licensed in Oregon in 1990 by endorsement. I came in on Washington. Hello? Oh, I was licensed in Oregon in 1990 by endorsement. I came in on a Washington license. At the time, both states had practical exams, and the Washington licensing requirements in terms of hours of education actually exceeded those in Oregon at the time. I basically did not have to take the Oregon written exam, which was written and administered by Oregon. We didn't have the national exam had just come into being then, but at the time Oregon had its own written exam, which I never had to take because I was licensed by endorsement. I did have to do the Oregon practical exam, which was, in existence at the time.
Yeah.
Actual licensing by endorsement has been going on for a pretty long time in Oregon.
Yeah. So obviously there were other states that, in this case, Washington, that allowed endorsement. It's a lot different now. So the statute gives that authority. The rule is different now than it has been in the past, is what I guess what I'm getting at. What still remains is the license by endorsement for medical professionals or healthcare professionals or something like that. I don't know how exactly it's worded, but it's if a doctor or chiropractor wants to get endorsed and they have the education to do it.
They can skip the MBLEX.
They can skip
but
the.
They have to take the practical. That's how it's written.
Exactly.
Okay. And that's in statute.
So does that answer your question?
Kinda. How would one go about getting the interstate massage compact written as a rule?
Well, you can't write it as a rule. Interstate compacts can only be accepted by the state of Oregon. So there has to be a bill, and the legislative session has to be sponsored, and then it goes through that legislative process, governor, all of that. I was on the Interstate Compact Committee to build the Interstate Compact through a couple of different. There was a League of Oregon, not the Oregon League of I can't think states or something like that. And the Defense Department had it. We're part of that committee. So we wrote it. There's I think one state. There's two states.
Nevada has.
Nevada just there's two states that have approved to be in the interstate compact. I think there's 6 or 8 that are required for the compact to become effective or become activated, basically. To answer your question, it has to go through the legislative process.
Thank you.
Usually the legislative process, since as a state agency, I can't lobby, okay? So usually the legislative process goes through the trade organizations, like AMTA.
Could sponsor the bill.
However, there might be some fractured issues regarding support for the interstate compact by some of those trade organizations, which is why maybe it hasn't gone through at that point. So if you have any involvement in those agencies and you would like to see that go through, then I would reach out to those agencies. They have legislative people that might be able to push that through and get some legislators to support it.
Thank you for the advice.
Yeah.
Which is the same way we would end up doing if we wanted to change that healthcare board member requirement. That's not the process. That's what we're, the situation we're in, any of that, yeah.
Understood.
Good question.
Thank you.
Okay, anyone would like to introduce new business? Okay, then we will go ahead and move on to our public correspondence. We had 2 correspondences which were attached to the meeting minutes. Are there any comments from the board or staff on the correspondences?
I read both of them, did some research. What do we do at that point? Just talk about what we think about them?
So one of the, I'm gonna just add something if you don't mind.
Please.
One of them are asking for an exemption, basically, right?
Exactly.
So let's talk about that a little bit. The board.
Can I interrupt? I'm sorry, I didn't see the part of the letter asking for the exemption. It was the explanation of the technique, but that part of the other part of the letter didn't come through.
Oh, okay.
So I don't know if everybody got that context.
Yeah, so I apologize for that. Basically, that individual is explaining their modality.
Right.
And saying that they would like to be exempted.
Exempt, right.
So let me give you a historical perspective of the board. When I first started here, previous to that, the board reviewed some modalities and exempted some modalities, like reflexology, right? Reflexology is in Feldenkrais, I think there's a few that are listed in rule. Actually, in statute, maybe too, there's a few that are exempted. So as that sort of progressed, back when I first started here, there were a couple of other modalities that came in and said, we'd like to be exempted too. The board had them do a demonstration. I remember it very clearly. The board went out, they did a demonstration of their technique and reviewed it, pushed it off several board meetings to get documents from them. And the board came up with this. They decided that there are a lot of modalities out there.
Yes.
Okay. And there are a lot of modalities that are under one umbrella that do it differently. Okay. So if you have a technique, and it's called fascial stretching or whatever we want to call it, myofascial release. But if you look at the 10 different modalities under that particular heading, they all do it maybe a little bit differently because everybody has a different technique, right? So some of them may do mild, light touch, some of them may do heavy touch, some may do massage, some may do not do massage, all that stuff. So the board said, listen, we'll review this. We reviewed it. We think that this particular one out of the 3 that were reviewed looks like it's probably exempt. We're not going to exempt it. What we're going to tell you is, and what we're going to do in the future is we're going to refer you to our law and rule. Our rule says that there's the 5 things that exempt you from a massage license, okay? Having a disciplinary process, light touch, there's like 5 things in there. If your modality or technique complies with those 5 rules, then you're going to be exempt. We're not going to have a 700-page rules that exempts every modality. We're not going to spend all the time to review every modality, every new modality that comes in, and exempt them specifically in statute, because that modality might change, because somebody else might throw another modality in there that's different, and later on say, well, my name is this, I'm exempt, right? Because it says in your statute or your rule that I am. So the board was very cautious about that. There was a lot of discussion. It went over 4 or 5 board meetings where they had our attorney come in and talk about the legalities and things like that. And the board decided to do that back in that day. It was about 2013 or 14. And the board has held to that ever since. That we just explained to the individual, this is the rule. This is what it says. If your modality follows that rule and the law, it's exempt. If you're doing anything outside of that, you need to have a massage license. That's how the board decided to do it. That's the historical perspective I wanted to bring to you.
Thank you.
Yep.
Any other questions about that letter?
Yeah, and
So-
my understanding is that people, that certain people may be practicing exempt from licensing because their modality, fits into the language that's been listed, and their certifying organization meets certain requirements, and that beyond that, it's on them, and it's a complaint-driven process. If someone files a complaint about somebody practicing unlicensed, then we look into it, and then that's when we would get into the role of trying to determine, is this exempt practice for this individual practicing in this way, whatever it is, or not.
Yes, that's my understanding too, Carol.
And the staff will usually respond back to them and let them know, in this case, that what they're showing does not meet the requirements written into the rule.
We respond to every letter. We respond to every letter, sometimes from direction from the board, sometimes the board will just tell us, thank you, the board reviewed it. In this case, we'll respond as I just said, that if your modality follows the rules, then it would be exempt. But it has to meet all the criteria.
Does that help with how this process?
Yeah, no, I was just wondering what process we do after we've read all of this.
There you go. Okay. Okay, and the other letter, is there any comment on?
I looked into that a lot too, actually. Who answers these people? Like, who writes them back?
It depends. I mean, if it's usually me.
Okay.
But sometimes Akatia will answer them if it has to do with a different part of what we do. If it's a compliance issue, sometimes Jeff will answer, but it's mostly me.
What did you guys come up with? Because this was created by an esthetician. So I kind of think it's funny that the massage therapist is like wondering about it. I mean, I see her point, but.
All right, so are you asking what the direction or what the response
direction are you?
So-
I guess so, yeah. 'Cause-
So if the board doesn't direct me how to respond, I respond by saying, the board has reviewed your letter, and thank you very much for your concern. It's kind of a form letter that doesn't give a lot of information, because sometimes we don't have an answer for people. So on this one, I would have to review the letter and kind of see how I'm going to approach it, but it's going to be something along that lines, is that thank you for your concern. The board has reviewed that, and we'll keep an eye on it, something of that nature. If the board directs me to write something different, then I'll write different.
And if it's a issue with estheticians too, like something they could deal with their board as well.
Yeah, in this case, but that's probably what I would do is write, if you have a concern, then you can reach out to the esthetician.
I mean, and sometimes techniques are governed by multiple boards.
Yep.
And we have the ability to do that modality if you're trained properly. And if estheticians can do it as well, then we can all do it.
I mean, I think if they have a certification in it or whatever, I mean, her concern is they're going inside of people's mouths, and she thinks that they need to have another certification. But my daughter's an esthetician for Oregon, and I asked her if they know the muscles and the nerves of the face, and she said, yes, they probably know it more than we do. So, and use it a lot more. So.
We kind of had this discussion last time, but I think their saving grace here is that it's being sought out as a beauty treatment and not a muscle treatment.
Right.
Yep.
And that really puts it in their scope of practice.
Rather than the healing or health benefits.
Right, they're not doing it for muscular reasons. I don't know, I do think it can be kind of a slippery slope. You know, it says they're doing the décolleté, shoulders, neck, scalp, like that's a bit beyond
They do
what
that
I
in
would.
estheticians.
I mean, the nice thing though
Not
is that
massage.
all of what our scope of
They're not
practice is all written into rules.
They can massage all of us.
So we always go back to scope of practice, and it becomes pretty black and white when we start looking at scope of practice, luckily.
And there are some historical exceptions for certain amounts of massage, like hair barbers, for example, goes back to a long time ago, where they give the scalp massage with the weird vibrator thing, and you know, and they're still allowed to do that. So it's just a historical thing that they have. It's limited, but they can do shoulders and heads.
Yeah, what I was telling Ray is from my understanding, they can go lymphatic into the neck, the head, the scalp. They can't go anywhere else, but they can go face, neck, feet, even the hands and the feet.
That's reflexology, they may
When you get a
incorporate
pedicure,
Except
they
you have
massage your
pedicure
feet.
and getting your nails done, yeah.
Right,
That's
and
part
they
of the
do the
pedicure,
massage,
that's
it's part of it.
Let me
See, some
let me
industries
add
cross over.
one thing real quick. When I spoke with this lady, the one other thing that she was extremely concerned with was the fact that this particular type of practice is reaching into internal cavity. If you believe that estheticians can go into the mouth to sort out TMJs, I mean, when you start talking about TMJ, now you approach, I mean, I'm no expert in massage therapist, but I do think that, you know, she has a good concern here. But then again, that's up to you all. But she's concerned that they are coming into the part of rule that we have in place that you can't even do unless an individual is 18 and up. Internal cavity, you know, going into the mouth. So that's
I think
what
though
she's
that would be an esthetician board issue.
Yeah.
Because the
You know, not-
esthetician board says you can do it for beautification, but you probably can't do it for treatment of TMJ.
Yeah.
That should be a dentist or us.
So I think it would be, in this particular case, to tell this individual that if you know of estheticians that are doing this, we'll certainly refer this to the esthetician board, or maybe you can file a complaint with them regarding what's going on, and they can look at their policies and procedures and practices and see because if you're an esthetician doing that and it's outside your scope, could it fall in massage? Yes. Is that person licensed as an esthetician? They are. They're doing it under their esthetician license, so it's a violation to that board, not necessarily ours.
It's a much better place to look at it than
It really
licensed practice. That's for
Yeah.
sure.
So we can refer this to the esthetician board and recommend that she reach out to the esthetician board also. That might be a way to handle this.
I like that.
Okay, anything else? Any other questions? New business to come forward? Okay, then we will go ahead and move on to public comments. Excuse me. Public comment is limited to matters on the public meeting agenda or otherwise relevant to matters that may come before this agency. Comments will not be allowed that are longer than the time allotted by the chair or are disruptive to the agency's conduct of its business. Any member of the public who would like to address the board, please turn your camera and microphone on. When your name is called, please state your name and license number for the record, and keep comments to 2 minutes or less. And at this time, if you were not introduced during our initial attendance at the beginning of the meeting, please also state your name and license number and where you're calling from, so we have you on the record.
Hi, I'm speaking for attendance. My name is Ashley Hernandez, and I am the Government Relations Manager for the Federation of State Massage Therapy Boards.
That's how we got.
Yeah.
Thank you, Ashley.
Always here to help.
Here, I thought you could read minds, but you were just spying.
That's everyone.
Nope.
Hi there, can you hear me?
Of course.
Yes.
Hello, it's Krista Rodriguez, LMT number 13287. I just wanted to say a couple of things. First off, hello, I miss y'all. And I also wanted to I also wanted to welcome the new board members as well as our new AAG. I saw that Lori retired, right?
Yes.
Awesome. She's great.
So we have Angie.
What's that?
I said we have Angie though.
Yeah, I know. So welcome aboard. Also, I just wanted to touch back on the FSMTV delegate and going to the meeting. I'm trusting that the budget will turn itself around, knowing what I know after been through COVID and all of that. I'm glad you voted on bringing someone else in. It's just your mind can open up in ways you just didn't even know. And being able to talk with other boards and executive directors and liaisons, it's just really going to bring back home what we stand for. So yeah, have fun. I was there 3 times myself and it was great. So good seeing y'all. Great meeting.
Thanks, Krista.
Thank you. You are missed.
Yes.
Anyone else who has joined us or would like to speak? Contact, I can't see if there's anybody.
Nobody's
Okay.
activating.
Anybody else?
Yeah, we do have a few people, but only Krista. So
We have people who are what?
we do have Lisa, we have Laura, but they are not activating their mics, so I'm assuming they are good.
Okay, thank you. Okay, then we are going to go ahead and move into executive session. Massage therapists will now meet in executive session pursuant to ORS 192660 to discuss certain matters on the agenda pursuant to ORS 192660 2F, to consider information or records that are exempt from law from public inspection, ORS 192501-4, to review, discuss, and consider written legal advice provided by the Department of Justice pursuant to ORS 192660 2F, or to consult with counsel concerning legal rights and duties regarding current litigation or litigation likely to be filed pursuant to ORS 192660-2H, to consider and discuss in executive session information obtained as part of an investigation of a licensee, application, or other person alleged to be practicing in violation of law pursuant to ORS 192660-2KL and ORS 676175. No decision may be made in executive session. At the end of executive session, the board will return to open session and welcome the audience back into the room. ORS 687-0815. Prior to imposing a sanction under ORS 687-081 or any rule of the board shall consider, but is not limited to considering the following factors: the person's past history in observing the provisions of ORS 687-011 to 687-250, 687-895, and 687-991 in the rules of the board. B, the effect of the violation on public safety and welfare. C, the degree to which the action subject to sanction violates professional ethics and standards of practice. D, the economic and financial condition of the person subject to sanction. And E, any mitigating factors that the board may choose to consider. Representatives of the news media and designated staff shall be allowed to stay in the room for executive session. All other members of the audience are asked to leave the room. If you are joining remotely, you are welcome to rejoin when we come back. Do we have an estimate on what time I think we'll be back?
What do you think, Rose? Hour and a half?
I think the agenda's about right, about 1:30.
Okay, so we should be back in public session at 1:30. And at this time, we are going to go ahead and switch over to our executive session. See you over there, Carol.
Thank you for attending.
Thank you.
Thank you.
It was really great to have you.
Come back soon.
Respect to music, does not volunteer.